grew up on a farm just outside of Diedrich, Illinois, about 30 miles south of here. My dad raised corn and soybeans, and it was originally a dairy farm, but kind of got out of that and into just some cattle. Went to Newton High School, graduated from Newton, and then went to Lakeland for 2 years. And I initially started out engineering, but quickly switched over to pre-med because I decided that I wanted to go to medical school and become a doctor. Initially thought I was going to do family medicine, but after doing rotations during the 3rd year, I fell in love with surgery, being able to work with your hands and fix problems that come through the office. Is really what kind of drove me to the surgery route. The hospital I worked at was very trauma heavy. It was a level 1 trauma center, so you get exposure to really bad traumas and complex surgeries early on. Got a lot of hands-on experience from day one. I had a pretty good idea that I wanted to come back to this area. I know a lot of people who work for Sarah Bush, a lot of friends, a lot of family who love what Sarah Bush stands for and how they treat their employees. Plus, I had exposure whenever I was in medical school. I was able to work with Dr. Walkner, who is a family doc here. I did a 16-week family medicine rotation with him here. So I got exposure to his clinic and kind of just the way that Sarah Bush operates and runs. Everybody gets into medicine with the idea, I'm going to help. That's the driving force, and it really has to be the driving force as to why you get into medicine. But what you really need to do, and what I find myself doing, is picturing the patients as if it's a family member who you're treating. It's just maybe it's your mom or dad sitting in that chair, and what would you do for them is really what you should be doing for every patient that you see.